Worldwide, a woman dies of cervical cancer every 2 minutes. But this is a preventable cancer, and 90% of these deaths occur in areas of the world where women have little or no access to health care. Basic Health International is a nonprofit working to eradicate cervical cancer globally. And here to tell us about it is board-certified obstetrician, gynecologist, and director of global health research at the Cleveland Clinic, Dr. Miriam Cremer. Dr. Cremer, thank you so much for being here.
Thanks for having me.
Tell us about your personal experience treating cervical cancer in Latin America and how that led to you founding Basic Health International.
Sure. So I was a medical student in 1997 at the University of Wisconsin-Madison, and I lived in a small village on the Honduran border. And you don't know that much as a fourth-year medical student, but I had the wonderful opportunity to really see healthcare in its most raw form.
Yeah.
And I lived with a health promoter, and one day we went to visit a woman in her early 30s with young children, and eventually she bled to death from cervical cancer in her house.
And cervical cancer is entirely preventable, correct?
It's entirely preventable. And more than that, as a public health person, we know the virus that causes cervical cancer. We have a vaccine to prevent that virus. And there's, we can find precancer for, 5 to 15 years prior to it happens. And, it's pretty easy to reach the cervix and treat the precancer. So really nobody should die of this preventable disease.
You were inspired then to start Basic Health International 10 years ago. And tell us what exactly you have done since then.
Sure. So mainly the project at first started just in El Salvador. We worked with the government. We spent a long time. It was just my hands and friends' hands who I brought down to do screening. And eventually, the whole teach a man to fish adage. So we wound up training Salvadoran providers to do screenings on their own. And then about 2 years ago, we had the amazing opportunity to be one of the first places, the actually first place in the world to use low-cost HPV testing to screen women. And we're now undergoing a 30,000-person implementation project in El Salvador. And the best news is that this program will be taken over by the government eventually and save thousands of lives.
That is fantastic. Now, how do you raise the funds for all of these programs?
So we have private foundation support. We have some federal government support through grants, and a little bit of luck.
Yes, yes.
So,
do you run into any sort of cultural barriers in some of these towns when it comes to women's health specifically?
I think it's particular with cervical cancer. It's a disease that affects everyone.
Right.
So it's the leading cause of cancer death in women in many places. And so everybody has a mother, a sister, a daughter, somebody whose life has been affected by it.
Right.
And so people are really anxious to get screened.
And I understand there's a new form of screening now that's very simple and easy, or a new German lab that came up with something that you may be working with?
So I think you might be thinking of CARE HPV.
Yes.
So the QIAGEN Corporation is actually in Maryland,
okay,
but they have headquarters in Germany. And they have developed a low-cost HPV test with funding from the Bill and Melinda Gates Foundation, so that the test should be under $5 a test, and that is amazing. And we've worked with health economists who have said that this form of testing will be much more both health effective and cost effective in the long run.
It sounds great. Dr. Cremer, thank you so much for telling us about all the great work that you're doing.
Thank you.